students, dear colleagues, dear attendees, welcome to this second webinar hosted by the Faculty of Philosophy in Skopje. The topic of today's webinar is social work and social policy in times of crisis, which of course is triggered by the global health crisis, which has challenged the existing social risks, but also triggered new ones. In this panel, I'm joined by colleagues Professor Vesna Leskošek from the Faculty of Social Work at the University of Ljubljana in Slovenia. Welcome, Vesna.
Hi, hello.
And also Professor Hubert Höllmüller from the University of Carinthia, University of Applied Sciences in Austria. Welcome, Hubert.
Hello.
There are also other colleagues which are attending. Welcome to everyone. I hope will be informative and interesting for all.
Data show that there was a significant number of social workers, also of social services, that closed doors for first 2 weeks, not allowing the staff to have any contact with clients. Others worked from home via telephone, not having any personal contact, and the third organized in a way that they reduced number of staff working at the location of social services, and then they took shifts. Now some of social services still work, social workers still work from home. Some do not have any contact still, and some of them already work face-to-face to respond to the crisis situation. The diaries point to the variety of problems. Social workers are frustrated and worried because they feel they left clients down. They are biased between the care for their own children's schooling because children are staying at home and parents are now responsible for children's schooling, and the need to assist and support their clients. People are left on their own, especially the most vulnerable people like elderly, single parents and others. There is an evidence of the increased violence in the family, especially against women and children. And the rise in poverty is also evident. What is clear is that the real impact of the lack of the contact will be visible after crisis, when we will have to face all the consequences, actually.
The first thing, or the main thing, is that social work is not regarded as a system-relevant service like healthcare. So there are no clear guidelines how to act in this crisis. And not only there are no clear guidelines, nobody from social work is asked about any kind of guidelines. So we have a system which is very splitted up, and we have 9 federal counties who just make their own policy, and we have 94 different child and youth care institutions who make their own policy, and we have no data about it. So this is the main thing. I just can tell you now about some information, some data I got, but we don't have a central Austrian institution who is gathering the data or who is advising the decision makers here in Austria. So it's similar as what Vesna said. Some of the services just were closed, and there was no contact possible between clients, service users, and social work professionals. And as we have a little different situation, we have a big private branch who is doing work for the public social work in child and youth care, and also there the organizations, the private organizations, made their own policies. So some of them just try to continue, try to keep on contact with clients or service users. Others just closed up. So we have residential care units who just closed up and sent back the children to the families. Or we have authorities who do not allow the children to go for a weekend visit to their families. So we have a very diverse and split up reality, but the main issue is we don't have valid data about it. So we just hear who is doing it this way and that way, but we don't get clear information. But what can we say is that not only from the decision makers and the authorities, but also from social work itself, we were not that confident from the first moment to say, we are specialists in managing crisis. So we know what to do, and we should work together and work out our guidelines. So this didn't happen too. So in one respect, social work, at least at the sector of child and youth care, just switched off by themselves. So that's for a first idea. Yeah.
It's what have been the major adaptations. As you can see, in relation to most of the cash benefits, the main modification was to expand the duration, which is expanded for the following few months or until this North Macedonia has a state of emergency condition. So until this state of emergency is still on. In that respect, so apart from expanding duration, there are waiving of conditionalities, expanding coverage, but also some administrative requirements which have been made simpler. I would say, apart from flattening the curve in this period, we need to make sure and watch the learning curve. In terms of what are the experience with these modifications of the social services or cash transfers, and whether anything new has actually shown that it works better.
I have to say that Slovenia resisted new public management for quite some time. As you know, in times of socialism, social services was funded by the municipalities. And in the transition, or actually in capitalism in 1992 in Slovenia, the funding role went from the municipalities to the state. So now the social services depend upon the state, they are not so much connected to municipalities anymore. And this has actually consequences. The centralization has consequences. And because of the fact that throughout the decades of having the capitalism, and also that the sort of the capitalism is more and more neoliberal, also the historical memory of the welfare state is actually not present anymore. There is no historical memory of the welfare state anymore. So what is happening now is more or less managerial changes. The institutional reform of social services started actually in Slovenia, in times of economic crisis, and intensified in 2016. Then it was implemented. The ministry established a total pyramidal structure of social services. Before it was horizontal. We had 62 social services and the state, more or less horizontal, I would say. But after the changes in 2016, they actually introduced this pyramidal structure of social services. At the top, it is a ministry. Then we have 12 clusters of social services, which are they are called central units. And then we have social services as units of those central units of social services. It is a little bit complicated, or I cannot explain totally. So altogether, we have 63 of them, including those 12 central units. Units like the smallest one, they have lost legal independence. They are not established as an independent entity anymore with its own financial background. They cannot receive direct finances and so on. So they have lost legal grounds. They are just units now. And they totally depend, actually, they are the last in the pyramid. Units also, the reform reduced professional freedom and independence. Professionals are not anymore allowed to speak publicly. They have to ask for the permission before. They mustn't criticize publicly the social services. Even though some of social workers still speak publicly, but then they are actually under all sorts of different controlling practices. They are also limited in a way, they are limited in choosing, they are also limited in professional freedom, they are limited in choosing methods of work, for example, in relation to legal authorities, like when they are working under sections. They are limited in going out, working on sites with people also. For everything they have to ask, and the communication is exclusively top down, what causes also all sorts of problems. Social workers are not, I mean, social services are more or less also publicly understood as controlling agencies. They are limiting us, they are limiting access to social benefits, they are taking children away, and so on. This is the common public image of social services in current times. The change is actually a result of changes in the understanding of the welfare state and increased pragmatism. Everything is very pragmatic. It has nothing, it does not have a deeper roots, I would say, like thinking and so on. Social policy is understood exclusively as part of the economic policy. Social policy is meant to support the boost of the economy and not to criticize it for producing poverty and straighten social inequalities. The latter is seen as a personal failure of people, social inequalities, I mean, and not as a structural problem. The ministry, which is in a position of power and has all the strings in its hand, also has no historical memory, I would say. They also have no knowledge of welfare state and social policy. Mostly they are coming from the economy. The major impact of all these changes is that they base the changes on suspicion of people to abuse the system, to cheat when claiming social benefits and when asking for services. The control is established top-down. First, the ministry is controlling directors. They are controlling units. Units are controlling staff, and staff is controlling users. Even though I know that this is pretty cynical assessment, I would say, there is quite a lot of truth in it. So I will leave open doors for discussion later.
I think this might sound very familiar to many colleagues in many countries, but the decision makers of our government had only two types of advisors, virologists and doctors. So it seems that whole science just consists of virology and medicine. So from the beginning on, they didn't take any regard or in any account that there is also a social or a social science dimension of managing a crisis. Public health and healthcare was defined as a crisis important, and all the other services were not. So we had just to orientate on the general guidelines, how to act and how not to act. And that shows just the lack of importance that is seen by the government what to do. Of course, in Austria, we have a rather well-developed social support or welfare system. So the financial support does work, of course. So we have about 1.2 million workers now in short time working models, where the enterprises get support to pay the wages. We have an increase of unemployment. The unemployment rate now went up to 12.8 in April, from about 5% in January. and they all get their unemployment support. So the financial side works, I would say. But as we also know that the risk for poverty, for families or for single mothers or single fathers with children are getting high, and we have no data about it. We have also discussed a little bit about the increase of domestic violence. And as our government now, and also nearly the whole media, they just stick to figures, you know, they said, because there is no increase in figures about domestic violence, there is no increase in domestic violence. But this would be a thing that should be researched on. So we could say maybe there is the communication between neighborhood, families, and also social institutions and the police, etc., don't work or work in a different way in crisis situations. But of course, we suppose that there is an increase of domestic violence, especially against women and children. But this is not something that is discussed about. I would say from the beginning on, the government only listened to biologists and doctors, and this is how they made their restrictions and how they made their concepts. And because the bigger party in our coalition is a party who is representing the economic field of our society, they just always talk about how can we support the enterprises, how can we save jobs, but saving jobs means supporting enterprises. So this is what it's all about. And now we're discussing about how we can support restaurants and tourism and so on. But we don't talk about the people who need psychosocial support. This is not, they are not existing in the public discourses so far.
Going back to benefits, I would also maybe briefly like to mention here the idea of the universal basic income as a possible solution in times of crisis. I think as a region, at least in this part of the world, we have probably lost a good chance to test this social experiment, because already now in the second month or ending of the second month of this crisis is too late to initiate it. But probably at the beginning it was too difficult to perceive how long this crisis will last, and financial implications were the major concern. But in a way, I would say, in regular context, in regular circumstances, I belong to the camp that is against the universal basic income. But in this context, I would say all the arguments that stand against or at least most of the arguments that stand against the universal basic income, such as that it removes the incentive to work, or it leads to labor and skills shortages, or that it crowds out social services, or it does not reduce poverty any more than the other cash benefits do, or targeted cash benefits do. I think that the context has been totally changed now. So there is the economy, there are no incentives in the economy. The social services are really difficult to access, and they are also facing a danger of discontinuation. So this type of social experiments, such as the universal basic income, would have been a good chance to somehow increase the income security, preserve the also incentive to work and look for a job, but also mostly, I would say the main goal behind the UBI in these times would be not really to reduce poverty, but to lead towards increased social solidarity, which in a long term can, well, at least in my perception, lead towards options for a more universal social protection. We've lost a historical possibility here. I mean, all what history of social policy taught us is that the major crisis events, such as the social threats at the end of the 18th century in Germany, or the Second World War, or the Great Depression, has supported or have actually been a reason for the introduction of the major social legislations. such as the Bismarckian Social Insurance Acts or the Bavarian Social Model or the US Social Security Act. So I think this crisis would have been an option or a chance to introduce a different kind of thinking or a way of social protection, which could have been based on a more universal principles. At least people in the social sciences have agreed at the beginning of this crisis as that we hate the term social distancing. And however, Vesna, how will this idea of social or physical distancing impact the operation of social services in the future?
Yeah, I think that was actually something what came out from the World Health Organization, isn't it? That they started to speak about social distancing, but the states were very willing and very fast in taking over the world without actually thinking, I would say. And this is also what Hubert actually is raising all the time, that the health profession prevail in this crisis. So social work or other social sciences are not asked at all for anything, I would say. There was a debate in Slovenia about the term social distancing, but actually there is a drop of truth also in what is happening now. As we know, social distance in sociology means the distance between social groups. The main users, but actually the main users of social services are people that are on the edges or the margins of the societies, isn't it? So this is the social distance is also visible in who is using the social services and who is now impacted with all the practices that I named before. Controlling nature of social services apply actually mostly to them. The example of conditionality, I already wrote about that and also spoke about that quite a lot, of recipients of welfare cash benefits tells us a lot actually. The conditionality itself is a controlling practice, because it acts like a border, it acts like a door to prevent you to access your rights. So the conditionality itself is a controlling practice because it is based on the conviction that just people that behave in a certain socially desirable manner are entitled to receive the support of the state, actually the support of hardworking taxpayers. The state is suspecting the morality of claimants that are not providing for themselves with hard work. So this is the basic, because when Slovene law on social benefits changed and the conditionality increased enormously, just that you have certain criteria. This is not about the criteria of the access to social benefits. The condition is that you have to fulfill certain way of behavior or certain way that shows what kind of person you are to access the social benefits. Like in Slovenia, for example, one of the conditions was that a person, that social service staff has the right, even though you fulfill the criteria for the benefits, but if the staff assess you according to your look, how you look, what kind of clothes you wear, and so on, they can still decline your claim. So it is around how you look and what kind of person you are, and in this sense, conditions are highly problematic. The result is actually minimization of cash welfare benefits, the proliferation of activation paradigm. Activation paradigm for me is actually a picture of all these neoliberal practices that are reflected in this. I think that the activation paradigm actually changed or reflects the changes in the welfare state, and actually subordinates people totally to labor market conditions. And in this sense, also social policy, it is very well visible how social policy is totally subordinated to economic policy. Whatever social policy has to do, it has to activate people to enter labor market. This is the main reason for existence of the welfare state. What is actually also how to provide a market with the subordinated labor force.
As I said in the beginning, we don't have real data, but still we can assume some phenomena. And I think we can assume that there will be an increase in poverty risk and poverty in Austria, even though we are on a high level, I know. There will also be a documented increase on domestic violence. And for the third, I would say, since this weeks and months now, I mean the social service, social work, we lost contact to the most vulnerable groups, like children at high risk, but also others. We lost the contact. So the thing is, how will we get back this? And we have some signs that there will be more money for social work in the future, but we also have other signs who say nobody can be sure which kind of service will be financed in half a year or in 1 year and which not. So we can be sure that there will be a big increase in needs for vulnerable groups at least, but for the whole people here in Austria. And we cannot be sure if we can go on with the same resources, with the same money, or if we have there a cut down. So this is what we can expect. And I just want to mention, I forgot the economic sciences, because they are now on the road, and they just tell us what's going on in the next, or what can be going on. And they always talk about this economic depression. And so I would say we should also start to talk about the psychosocial depression that is coming, you know, what is already here.
Absolutely, I agree. And I think this webinar is one way of raising or putting forward more publicly these debates. Go to some of the questions. I'll start with the student questions. Is there anything that every country has to do for the citizens in terms of social policy in times of crisis like this one? I think the social protection systems are in a way what every country is doing in a different way, of course, in terms of both social services in provision of care, but also in terms of providing benefits. Another question, Paul, thank you. 2 questions. We'll go with the first one, which we really didn't touch upon. We know nothing about the most vulnerable: migrants, prisoners, people with disabilities. Can Vesna, Hubert, do you want to share your experiences or knowledge about these categories in the current situation?
I agree totally. We don't know nothing. I mean, how can you know? Because all the doors to knowing, to knowledge about that are closed. If social services are not acting, if they are not allowed to work, if they don't have, or if they are allowed just to react on negatives like the violence and child protection and so on, and not to be in contact with people, how can you know? It is also that, for example, elderly people are closed in their homes, and we are also closed. So there is no interchange. There are some small signs of what is happening. Also, elderly in residential homes. I mean, what Hubert said before, that children are not allowed to go home, or they are forced to go home and not allowed to stay in institutions. They expose them to enormous risks. So, yeah. This is, I mean, we are all in the same unknown situation now. Yeah.
Yes, I would agree to Vesna totally. And I think that the first the first step would be just to gather data about it. But this is, I think, this is a duty of the government. They should say, okay, we need data about these vulnerable groups, and so we should spend at least some little money on gathering it, you know?
Yeah, I just want to add that we also don't know what the government is doing. So what is going on now at the back of the health crisis? We just know, for example, that they limited the right to referendum in the name of the corona crisis. What is actually the limitation of the political rights of people. And so on. So we have no idea. I have no information what the Ministry of Social Affairs is planning, for example. So there is a lack of what we know is that we are bombarded all the time with the numbers of people that died or they are infected with corona. So this is everything what we know.
Yes. Paul posed another question. Well, actually, it's only his opinion. The universal basic income could still be introduced, but together with the radical tax reform, absolutely agree. But another issue is how to support grassroots solidarity. Paul says that it's his sense that this will need to be different in urban and rural settings, but thinking about this is really needed. In relation to the first part of your thinking, Paul, I would say maybe if we are, I mean, Croatia has already opened its economy, as I heard, and its borders. So somehow economy is starting. So introducing UBI in such a context might be probably more difficult rather than 2 months ago when we faced this lack of economic activity. That would be my thinking, but definitely I think you're right, and I think the UBI is not easily introduced in contexts where there is tax type of taxation, which as in North Macedonia is, and that is a flat rate tax. So you do not have progressive taxation, but you cannot really introduce such costly social experiments.
Yeah, we have probably very different opinions on UBI. I'm very much in favor of it. I see it as a sort of a welfare state, not against the welfare state. Actually, how the welfare state is organized, and what is very attractive to me, what it attracts me so much, is actually because it is unconditional. And the unconditionality is actually the mentality change. It is how you change the mentality of people. And I think that this is actually what boosts the solidarity and not what limits the solidarity. I think that we have to go away from people will abuse the state and they will not work anymore. And, you know, the liberal concepts of the UBA just wants money and then you will skip all the social benefits and so on. We have to be serious about it and we have to start talking about it.
Okay, I think we have exhausted more or less all the discussion points that we were planning to tackle upon. If there are no more questions from the attendees, thank you very much for joining this webinar. I will make sure, as I wasn't able to stream it live, I will make sure that it's posted at the social media after we end it. Vesna and Hubert, thank you very much for joining, and all the attendees, thank you very much.
Yeah.